Let's go ahead and get started. So thank you everybody for joining us for today's seminar. So my name is Tony Ward. I'm a professor in the School of Public and Community Health Sciences and helping to run the seminar program this semester. So today we're very lucky to have some folks from the State Health Department, Montana Department of Public Health and Human Services. And before I introduce the four speakers that we have today, just to put a plug in for next week's seminar, we have some more folks from DPHHS that will be joining us. Heather Zimmerman and Danny Power will be talking about public health surveillance data in Montana. So that will be coming up this time next week. So I will go ahead and introduce our four speakers. So I have, just bear with me as I talk through these introductions here for a second, and then I will turn it over to them. So first up is Mackenzie Jones. So Mackenzie is the program manager for the Montana Disability and Health Program, which is housed at Montana DPHHS. Mackenzie received her master's in public health and health education from Indiana University in 2019, became a certified health education specialist in 2017. Mackenzie is active in the disability section of the American Public Health Association, currently serving as a governing counselor. Outside of work, Mackenzie participates in community theater and trail running. So next up is Dr. Megan Traci from the University of Montana. She's a developmental psychologist with expertise in early childhood and lifespan development. Dr. Traci is the knowledge broker on the Research and Training Center on Disability in Rural Communities, drawing on over 25 years of experience in grant writing and a productive program of research, development, and systems change. She is a research professor at University of Montana's Rural Institute for Inclusive Communities, co-chair of the Human and Family Development minor, and a faculty affiliate in our School of Public and Community Health Sciences. She is the senior consultant on the Montana Disability and Health Program, and Dr. Traci currently participates in AUCD's Council on Leadership and Advocacy and AUCD's Special Interest Groups on Disaster, Climate Adaptation, and Disability Inclusion, and on Health and Disability. So next up is Ms. Shyla Patera. So Shyla is truly extraordinary when it comes to perseverance and overcoming obstacles. At an early age, Patera endured 4 surgeries and hoped that she would one day walk. She was eventually diagnosed with cerebral palsy and accepted that she would never walk. However, she remained focused on her dream to go to college, even when others said it would be impossible, and her determination to achieve her goals never wavered. In 1993, Patera graduated from Montana State University, and words cannot begin to describe her fortitude when helping others despite the significant limitations in her role as an independent living specialist at North Central Independent Living Services Incorporated in Black Eagle. She remains a constant citizens advocate and has spoken before the legislature in advocacy for others. Patera knows the challenges facing the future, but remains undaunted in her enthusiasm to continue making a difference in the lives of others. And then last but not certainly least is Miss Erin Bley. She's a health education specialist with the Montana Disability and Health Program and Montana Arthritis Program. Erin has a health and human performance degree from the University of Montana, as well as a health enhancement certificate. Erin holds various certifications through the American Council on Exercise, and she works to refer and link people with disability to health and wellness resources. Erin received her Master Trainer certification in Stay Active and Independent for Life, or SAIL, and looks forward to supporting you and your facility to bring evidence-based programming to your participants. Erin was nominated and is currently serving as a member of the National Arthritis Steering Committee for the 25-26 term. So that's a lot of introductions, and I will go ahead and let you guys start taking it away from here. So Mackenzie, I think you are first up.
That is correct. Thank you so much for having us. The title that we have for today is disability, health, and leading systems change. And that is really recognizing that we can't do the work without our partners in the community, locally, state, and nationally. And the work that we do goes beyond just education and awareness, and we'll talk about that. And Shyla and Meg are here to talk about projects that we have been working on for many, many years within this program and the impact it has made on Montanans. So to get the juices flowing, we're going to start with the video. This video is from the from a grant from the National Association of Chronic Disease Directors Inclusive Communities Projects. Montana received a grant for 2 projects, one in Helena, one in Butte. And this is the Helena video, and the resources, we will also include the link to the Butte video. And it really shows how working together with people with disabilities, disability organizations, and public health leads to systems change in the community. Then Erin will walk us through a couple questions to get you thinking about what is most important to you and what's relevant in your work. So we'll start. Oh, I want to make sure that I shared my screen with the best quality, so I'm gonna stop sharing real quick. And I did. Okay.
For those of us who don't live with a disability, it's easy to go through our day-to-day life without thinking about a lot of these physical barriers. They might be actually at the policy level. Just because someone's living with a disability doesn't mean that they should have limited access to every other part of their life, which is absolutely the opposite of what our mission is. Our mission is to ensure the health and safety of all people in Lewis and Clark County. And we can't do that if we are accidentally, inadvertently leaving people out.
So within the department, we started by just bringing together the work group. And so that was something that we didn't have before. So that was kind of a new and innovative way of approaching a need within the department. We found a lot of success inviting individuals with disabilities into that work group to help us learn and gain a greater awareness and a better perspective.
One of the great things that's come out of the inclusiveness work group is our inclusive policy at the local public health department level. That policy is really pretty groundbreaking. So when we make a decision to implement a policy, every decision that's made after that will be made through that lens.
Anybody can look at the Americans with Disabilities Act, talk about path of travel and how high a countertop should be. And I was invited to the table to fill a specific role. And that role was to give the perspective of somebody with a disability, not just how my physical disability affects, but also the mental and emotional part that everyone that struggles with a disability faces. So little things like the door into the bathroom. And so by just making a small adjustment in the tensioner at the top of the door and make it easier to open and close, improve somebody's life right there, making sure that signs are identifiable and they mean what the person who placed them meant for them to say. There's a system now that can let the fire department know I'm here, I'm safe in this area, but I am going to need assistance getting up and out.
When we create a culture of inclusion within our health department that leads into our community, we start to change the way that we think. Our lens shifts. Some of the big outcomes of the project are the inclusive wayfinding system that the city adopted was made inclusive by choosing specific fonts and colors and sizing to make sure that it's visible and readable to everyone. charging stations that are located in the city county building and the Capitol building are great examples of small changes that can happen that make a big difference.
We did a community-wide assessment that showed that we had this really great trail system. However, the trail system didn't necessarily meet the needs of individuals with disabilities. So we used walk audits that allowed us to see through their eyes and through their perspectives where our community fell short and where we did really well. And we could make some plans and adjustments from there.
The reality is that a city can be held liable if someone doesn't have access. There have been lawsuits that have been filed and won by individuals in communities. And as a result, a city or a municipality is responsible for, over time, making those changes. And we use these walk audit trainings through ongoing work in the community to make sure that as changes are made to our built environment, they are done in an inclusive way. You don't have to wait for funding. There are so many small changes that can be made that don't actually cost any money. Bringing people together, asking the experts, asking people with lived experience, those who do live with disabilities every day, and bringing them to the table. That's been the greatest eye-opener for our work group and for me individually. So it's really exciting to see that long term, when you create a culture of inclusiveness, it's not a heavy lift anymore for us. It's just happening naturally, and it's the way that people do business, and it's the way that people see the world.
So now it's all of your turn. We would like to hear from you. So as you were watching that video, and feel free to come off of mute or share in the chat, but what did you see or hear that stood out to you?
Hi, this is Victoria from By My Deaf Reporting System. What stood out to me was really highlighting the message that this helps everyone and that a lot of accessible things that were initially created for accessibility for certain items have been helping everyone and continue to help everyone throughout Lewis and Clark County. So I think that the video was really great in highlighting that aspect, that people may not realize that some of the slants on sidewalks, for example, were initially for accessibility purposes. So I think that the video did a great job highlighting stuff like that.
Great. Thank you, Victoria. Did anybody else wanted to share? And I can put the question Anna shared in the chat, the importance of lived experience. Yes, thank you. Anyone else want to share? Again, feel free to come off of mute or share in the chat. Thanks for interacting with us today. Okay, and then what was most important to you, or what was most relevant to you maybe in your daily life or in the work that you do? So were there a couple things, again, that might have been important or relevant to you with your work or in your daily life? And again, feel free to share in the chat if you don't want to come off mute, or you can come off of mute and share as well. Victoria shared the charging station was great to learn about it. I didn't realize it was a need for certain accessible tools until the video. And Lauren shared improving accessibility doesn't always require a big grant. Little changes can make a big difference. Thank you all for sharing today. We appreciate it.
Thank you, Erin, for leading us through that video. And I'm sure that as the day goes on, you'll think back to the video and remember some important things that came up. So we are the Montana Disability and Health Program. We've been around since 2002, and Meg Traci, who's with us today, has been a part of that program since 2002 and has walked through the changes of leadership at the University of Montana, and then when it transitioned over to the Department of Public Health and Human Services, which is where Erin and I are, but we still work so closely together. And this current grant, so I think we've had 5 or 6 grant cycles, and this current grant is from 2021 to 2026, and we are CDC funded, and 9 other states also have this grant. So it's not just here in Montana, it is a national grant. And the previous grant, we had 19 states that were funded. This time there were only 10 states that were funded, and we have been encouraged by CDC to work together. So there are a lot of projects that we do that are being implemented across these 10 states, which is pretty cool. And so on the screen I have an image or a map of the United States with the 10 states highlighted, and those are Oregon, Montana, Utah, Missouri, Georgia, Ohio, Michigan, New York, New Hampshire, and Massachusetts. Let's see. Recognizing that we are a federally funded program, this grant is supported by a national framework. And for those who are not as familiar, but those who are familiar with the Healthy People 2030, this sets data-driven national objectives to improve health and well-being over the next decade. So these were developed and put into place in 2020, and the work of the researchers at the national level are to determine how well we are moving to meet these objectives over those 10 years. So for today, I pulled out 5 objectives that were relevant to 3 of the topics, or 3 projects that we've worked on over the last 24 years within this program. And the projects that we're going to focus on today are visitability, which is the idea that you have built a house or you're living in a house that people who may have mobility disability can come to your house. You can access the house, and future people can access the house, no matter their mobility concerns. And then breast cancer prevention is something that we have worked on in the past, and living well in the community, which is a chronic disease prevention and health promotion program that was developed with, for, and by people with disabilities, and is facilitated or co-facilitated by people with disabilities. And we'll dive deeper into what those projects look like and the impact that they have made on Montanans. But the objectives that I wanted to pull out that we set as the foundation for these projects include an objective to reduce the proportion of people with intellectual and developmental disabilities who live in institutional settings with 7 or more people. So getting people in the community into smaller homes with their family, with their friends, in the place where they want. Number 2, increase the proportion of homes that have an entrance without steps. That's part of that visibility and accessibility piece. Increase the proportion of adults who get screened for breast cancer. Increase the proportion of adults who get recommended evidence-based preventive health care, and this can include cancer screening as well as diabetes prevention program, living well in the community, or other chronic disease prevention and health promotion programs. And then reduce the proportion of adults with arthritis whose arthritis limits their activities. We know arthritis isn't the only condition that people may experience that limits their activities, but the idea of what we do, especially within Living Well in the Community workshops, is to decrease those limitations and support people in meeting their goals to live independently and to live, work, play in the place where they want. So what is disability and health? We may have heard in the past, like CDC has said, to decrease death, disability, and disease. And we're here to say that we are not focusing on the decrease of disability, but actually the recognition of disability as a community, as a demographic of people that experience barriers. And if we address those barriers in the environment, then we are opening up opportunities so that people with disabilities can live, like I said, live, work, play in the places where they want. And we recognize that they experience health disparities and health inequity, and that there are things we can do to decrease those barriers. And so our program, with the support of our partners, aim to increase health and wellness opportunities with and for people with disabilities through data, better understanding where those gaps are, education like this, reaching out to our colleges and public health organizations and community organizations, and building awareness and appreciation for the disability community, community partnerships. We'll dive deeper into our partnership with the Centers for Independent Living and why that is so valuable. And then policy systems and environmental change. We really can't decrease barriers sustainably without focusing on those upstream factors. And so those upstream factors include social determinants of health. And on the screen, I'm showing the social determinants of health wheel, which has icons for access to education, access to health care, transportation and housing, living in the community, and economics or financial stability or employment. And I want to remind people that the disability community is a significant proportion of our population. 29% of Montana adults have a disability. And so these are people we live with, we work with, we play with. These are our friends, our family, our neighbors. And that is why we need to build our communities in accessible and inclusive ways. And recognizing that more Montanan adults with disability than adults without disability need supports for these social determinants of health aspects. And so we're not just addressing chronic disease prevention and management, which are very important, but we're also looking at access to healthcare, housing, transportation, school, work, and living in the community. If you're wondering, as a public health student or professional, where we get this data, the census of the American Community Survey, as well as BRFSS, Behavioral Risk Factor Surveillance System, use the 6 disability demographic questions to better understand these health barriers and these health gaps and health behaviors of people with disabilities. And these 6 questions identify limitations of functioning for people who are deaf and hard of hearing, blind or low vision, people with mobility disability, cognitive disability, independent living disability, and self-care disability. If you haven't heard of those last 2, independent living disability means people that need extra support in order to pay their bills or go grocery shopping or get to the hospital or their doctor's appointment, whereas self-care disability are people who may need help bathing or cooking or doing things really in the home. So with that, I'm going to pass it over to Erin to talk about the power of partnership between public health and the Centers for Independent Living. She'll introduce the CILs and then ask Shyla some questions.
Thanks, Mackenzie. So on the screen is a map that shows the image of the 4 Centers for Independent Living that we partner with here in Montana, and they are the 4 Centers for Independent Living in Montana. So in the yellow is North Central Independent Living Services, which Shyla works for as an independent living specialist. And then in the blue is Living Independently for Today and Tomorrow. They go by the acronym LIFT. And then in the orange is Ability Montana. And then up in the upper west side or left in the purple is Summit Independent Living. And these Centers for Independent Living regions also support the reservations that are shaded in green within their location. Next slide, please, Mackenzie. So the Centers for Independent Living, this is a community living as the ability to live and participate in one's own community, as Mackenzie mentioned, allowing those with disabilities to live on their own terms. And the Centers for Independent Living do a number of things to support this. They use the phrase, nothing about us without us, and this advocates for genuine inclusion and self-determination, so asserting that any group has the fundamental right to be involved in decisions that impact their lives. These centers for independent living, as I mentioned, are disability-led. So over 50% of employees have disabilities. They're consumer-driven. They provide advocacy and support at all levels that include the housing, the transportation, the education, maybe peer mentoring and support, transitioning and helping with self-advocacy, maybe school to career transitions, maybe teaching and navigating local transits that might be available in our communities. So they make that community living possible and are a great partnership for us here at MTDH within DPHHS. And they're a resource hub to connect people to services that will support them to live, work, and play where they want. So with that, public health and the independent living philosophy. So Shyla, what does the independent living philosophy mean to you?
Hi, I'm Shyla. And as everybody has said, I work for North Central Independent Living Services in Black Eagle, Great Falls. And what the independent living philosophy means to me is all of us, including Montanans with disabilities and Americans with disabilities, have the right and responsibility to navigate services and choices to live in our communities of choice with or without supports such as community first choice, which is like home health care or assistive technology or different types of services for effective communication, accessibility modifications. For those that are transitioning out of their parents' home or other places, Montana Centers for Independent Living and other centers around the United States have skill support, information, and referral for anybody who is affiliated with or a person with a disability. And we also offer light skills training for and navigation of certain supports already talked about. But it's just that idea that people with disabilities can participate in the community to the extent possible, where services allow them to.
Great. Thank you so much, Shyla. So as we mentioned at the beginning, but you've worked with the Montana Disability and Health team for a long time, but what does a partnership with Montana Disability and Health mean to you?
The partnership, actually, I'll speak on two levels.
Okay.
For all the people in the SILs that you may have seen in the video, whom I have to thank, the staff at Montana Independent Living Project, now known as Ability Montana, who participated in that video, and Lewis and Clark, and in the work groups. The partnership that the SILs have with MTDH allows us to explore accessibility options, different successes and needs-based and evidence-based opportunities to improve accessibility in healthcare. Without it, I don't think that Montanans with disabilities would have as much in the public arena. Not to say that all of you and many others wouldn't work in the same way, but the Montana Disability and Health Program brings everyone together, because we are resources for each other, but we don't always know everyone else's resources. So it's always good to have that opportunity to explore different resources and different projects in the community. For me, myself, I would say that the partnership with the Montana Disability and Health Program has definitely made sure that I speak out for when I need certain things as I'm going to a doctor's visit, or if things don't seem quite right. I can always check with the partners in MTDH, and I rely on them very heavily in the information that they've taught me about accessible technology options, especially for exercise and precision medicine. And if I hadn't been a part of the Montana Disability and Health Program, I wouldn't have known what an accessible mammography looks like, what an accessible scale is, because a lot of places don't have those things, or a or help onto a exam table. I wouldn't have been able to ask for it as a patient myself. It doesn't mean that every chance I get, I always get what I need, but at least I know it's there and I can help others in the resources that they need.
Thanks so much, Shyla. Those are some great answers. And I know you kind of touched on this a little bit already, but why is the public health approach so engaging to you?
I am, as an independent living advocate, a lot of us use public health, and we may not realize it as people with disabilities, because many of us are just living our lives to the best extent possible. But without public health, um, engaging people with disabilities and engaging Montana Centers for Independent Living, we wouldn't have access to the opportunities that other places may have, be they bigger or smaller. I've helped with gaining policy for the Every Woman Matters program, and done mammography studies and ultrasound studies to make sure that they can let women and families and even men know that they need to make sure that their health is okay. I've worked on the I2 walk audits and studies on precision medicine. And if I didn't have those opportunities, I wouldn't know maybe what is coming. And I wouldn't be as educated in the healthcare arena, because sometimes disability, as we know, it incorporates part of the health model, but it also incorporates the social model too. And I think that's important. But I wouldn't probably know, because when I just started out as a young adult, insurance just told me where to go and how to access healthcare. And now I know if it's not accessible to me, I can't use it. And it means a lot that this partnership means a lot, because now I can help people as partners learn about accessibility. And for the consumers I serve, particularly in different populations, whether they're homeless or not, I can help them find the best built environment to get things done. So I really
Great.
think it's important.
Great. Thank you so much, Shyla. And we're going to talk a little bit further about some of those items that you just touched on and that we touched on earlier, but I'm going to hand it back over to Mackenzie to talk about MTDH and systems change, and kind of ask you some questions, Shyla, when she's ready, about some of these particular areas that you've been an advocate for.
Thank you, Erin. And I welcome Meg Traci to introduce these projects and have that conversation with Shyla. Meg.
Thanks, Mackenzie. And I'm just hoping to share a couple examples of how a public health approach and working with partners to frame disability, as Shyla said, from a socio-ecological model and not a medical model, can really lead to those outcomes. And I appreciate everybody's comments in the chat. That can benefit us all, whether we're living with disability now or may live with disability in the future. We may know somebody that is living with disability. So visitable housing is a term that we used a public health approach to become more comfortable with. as a disability and health state program. So this is a term that comes from Eleanor Smith, who's one of our leading disability rights advocates. We brought Eleanor to Montana as part of a disability and health program and a summit, and we brought our Centers for Independent Living and ourselves to the table. And Eleanor educated us about what it meant, what she had learned from years of advocating, that it's not a house-by-house endeavor. It is going for policy change, and she gave us different examples of ways we could work towards that. And we had funding for 5 years then to basically take the training that Eleanor had gave us and organize quarterly meetings with stakeholders across the state to share about visitability and some of the opportunities we had to be building out more accessible and visitable homes for people. And we started with some of the data that shows how important it is to live in your home for your public health and accessing things that promote your health over long term. So we began that work in 2007. I'm glad that we started with Healthy People 2030 and that objective. It is the work of Shyla, Patera, and Centers for Independent Living and Eleanor Smith and people here in Montana that then we had meetings with CDC and federal agencies, and that led to the objective in Healthy People 2020 and now Healthy People 2030 around visitability and that this could be a public health approach. But just for folks, visitable homes are one, I think if we activate the bullets, it's 3 basic standards. ADA does not cover housing, right? When we build out accessible housing units, that's through fair housing, and it's not with all housing. It's with housing developments of 4 or more units. So visitability is a way to start before the house is built to say, here are 3 essential features that we need to put into the design of the home that are hard to retrofit later. Costs nothing to do it at the time that the home is being built, but to retrofit it later is very expensive and often comes at a time when people can't manage that kind of remodeling or home renovation. So a visitable home is designed with 0-step entrance and usually on a accessible path of travel. Doors with 32 inches of clear passage space and at least 1 bathroom, half bath on the main floor with that clearance space for a wheelchair. It often comes with reinforced walls so that you can add grab bars later if needed. So we worked from 2008 to 2012 with the Independent Living Housing Task Force as well as the Montana Home Choice Coalition led by Mike O'Neill, who I can't not mention in this space, who's our housing authority leader in Helena now. But we really worked hard just to educate the stakeholders, and it was then the personal testimonies that we collected statewide from people with disabilities and we read into the record of the Board of Housing that led the Board of Housing to finally change some important policy that now means that any single-family home, duplex, triplex, that are not covered in fair housing are built with not just universal kind of design building standards where you have kind of the doorknobs and the outlets at different heights, but that we actually require in all of those housing types of these 3 critical features for affording access and aging in place. So I want to share more about that, but through this collaboration, we spoke with over 9,000 stakeholders, home builders, realtors, people with disabilities, housing authorities, Habitat for Humanity chapters statewide, just by putting in our deliverables with our partnerships to have these quarterly meetings and bring stakeholders together to share the data, to share the best practices, to share what other states and organizations were doing to advance policy to promote more visitable homes. And I'm not sure we want to say more than that. I think we have some opportunities for Shyla to share some of that perspective.
Thanks.
Well, thank you, Meg. As it shows on the slide, the question that I'm seeing is how housing policies change lives. I think the work of MTDH and the Housing Task Force that the independent living centers have, we have several different task forces on many issues, have allowed us to grow accessible, affordable housing stock. And we've also expanded our outreach into also looking at homelessness and accessible shelters and services to people with disabilities in the shelters. It's still a battle moving forward. Not to say that it's a war, but a lot of people see the benefits of visitable design and universal design, but they kind of say, well, especially for home ownership, they say it has to come from the homeowner. So it is kind of like on a house to house basis, unless there's um, project money being built for multifamily or single family units through the Board of Housing. That doesn't mean the battle is completely lost, but we've done a lot of work with our builders, and the centers have all advocated for the visitable policy to be in state law, but we've also advocated for non-discrimination policies and different things on source of income, which means like landlords and tenants can't if it would pass, it means that landlords and tenants can't discriminate on the basis of disability. And our state legislature just passed like a change to our Montana Housing Trust Fund, and we hope that disability and universal design will be a big part of those uses. So it's not just advocating for the basic housing policy, it's also advocating for a more inclusive community, because the more you build visible homes and visible apartment projects, your neighbors can interact with you, and that's a big thing for many of us with disabilities. And so we're really excited. Centers are really excited to be a big part of housing policy moving forward. Our state also has its homestead policy, which is a policy where people with disabilities are to work and play in our own environments. And the executive director of the Rural Institute actually was on for a little while, Miss Molly Kimmel, and with housing, housing means home. And if people with disabilities don't have a universally designed home or a visitable home, they might have to go into an institutional setting or a different setting of care, which costs taxpayers a lot more money. So that's how I believe visitable housing policies have changed lives, and I've seen it work well with the people I've transitioned out or diverted from homelessness to apartment living and other types of living.
Thank you, Shyla. We're going to move on to the next project. And I do want to give a shout out to Meg. Traci does have a visitable home, and it always reminds me of anyone can make their home visitable. So thanks, Meg, for always being an advocate. So I'll let her go into this project.
Great, thanks, Mackenzie. I couldn't be like, I have this poster that we're looking at right now, which is it's an editing miracle. These 12 women were not all together at one time. We brought them in individually from across the state of Montana, women of different ages, from different communities, all who had experiences with breast health issues, all women with disabilities. We brought them in one by one January, and worked really closely with our School of Journalism and Jeremy Lurgio and students to really collect personal testimony and collect video to complement the CDC's first campaign promoting breast cancer with people with disabilities, really their first public health campaign ever targeting health needs and health disparities experienced by people with disabilities. So this was a way that we worked with our Centers for Independent Living and other disability partners to resonate the messages of the campaign with local spokespeople and their stories. So Every Woman Matters was an idea conceived of through our partnership with disability organizations and our Centers for Independent Living to promote the CDC campaign, which is called Right to Know, and to work with our Cancer Coalition and our early detection implementation team to give them some tools to kick off the campaign in counties across the state. And we worked really closely with some of our public health and anthropology students here at UM as well on that project. So this multimedia exhibit is something that we're very proud of. In addition to launching the campaign with messages from local spokespeople and basically some beautiful images, video to have kickoff events with our hospitals and mammography centers and our Centers for Independent Living across the state to launch the campaigns. Materials. We also worked with our Centers for Independent Living to go to every FDA-approved mammography center in the state and do an accessibility assessment using our Accessibility Ambassador program, which are staff at each Center for Independent Living who have extra training on doing accessibility studies and working with community partners on action plans to remove barriers and promote accessible facilities and services. So we went to every mammography center in the state and used a tool developed by an advocate in Massachusetts called the Massachusetts Facility Assessment Tool, as well as some additional questions that we identified with our partners here, and collected information and organized it into the Montana Mammography Directory that includes information that's important to everybody to choose a center and go get their mammogram and be ready for that call to ask for any things that you might need to have a successful mammogram when you're scheduling your appointment, but also with information that was specific if you were a woman with a disability, so that you would know if you needed to have more time in the exam room, for example, if there was not an accessible changing room, or if you would need to use a restroom in a different part of the facility if there was not an accessible bathroom in the mammography center itself. So all that information was organized into our directory, and it's our third edition. We've been updating it with the Cancer Coalition and our Centers for Independent Living, and we just put that online, so we're really proud of that. And there's a lot from this project that I want to share, but I'm excited to hear from Shyla some of the things that really were important to you. And I'll just share, this is an image of June Kales. Shyla, before you go, this is an image of June Kales from the CDC National Campaign. Perfect, thank you.
So June Kales is a advocate from California, and she is also a breast cancer survivor. Many of us in the disability community know her because in the state of California, she's been a champion for accessible awareness in disasters and how we all function as emergency situations, and she's been a leader in this. And so when I first met June, I was in awe because it's not often that national advocates come to Montana, just similar to Eleanor Smith. And then I got the materials, and I also learned that she was a survivor, and it took a whole different meaning for me because it wasn't like you don't take your screening seriously. If you're really thinking about it, you do. And when I learned that June was just like me and other people that I was working with through the Right to Know campaign and different things, I really started saying, yes, women with disabilities should have the opportunity to have an accessible um, mammography site, not just the center, but actually the um, mammography screening should be accessible to them. Many of the women that you saw on the previous slide, I had the opportunity to recruit and work with during the active time of the Right to Know Every Woman Matters campaign. And they became not only my peer advocates, my soundboards on a lot of the projects that I work with. They told me their lived experience, and it really helped shape mine. The favorite thing that I did in this program, because I was working with the Cancer Control Coalition and others to increase awareness of Every Woman Matters, and and even every guy matters, because cancer can strike anybody. And I don't mean strike, but you can be diagnosed or have a secondary or a first disability because of cancer. And a lot of times people with disabilities, due to barriers, they were missing their mammography or any appointments. And so one of the cool things that I got to participate in was we had a local event at our history museum, and Meg and I and the Cancer Coalition and the health department put together an event with pictures of disability history in Cascade County and throughout time, from the start of Great Falls till the present day. And it was just a wonderful exhibit. And every time I go out to measure a mammography center or a community healthcare center or rural hospital and clinics, I realize how important accessibility is in getting your screenings and present and future, because we know health guidelines will change. And I'm not just talking the current administration. We know that we'll have different pandemics or something happen in America, and we need all people to be prepared. And that's why I really think that this program was the start of it all, at least for me. It was the first project I worked on at North Central Independent Living, and I couldn't be more proud of it. And the poster and the postcards sit on my desk, and we have a picture of one of the women in my office. And when I'm able to take it out and do presentation, it isn't very often with the picture, but I do use the postcards and the some of the materials still to advocate for accessible programming.
Thank you, Shyla and Meg. I'm looking at the time. I'm going to push us forward. Thank you so much for diving back into projects that MTDH has worked on. And we don't put these in our slides because we're not working on things now. We put these in our slides because change takes time. And we wanted to emphasize that projects that started over a decade ago have made a difference. And that's why Healthy People 2030 starts a decade in advance and looks at change over that period of a time and brings those objectives from one decade to the next. So these are two examples of projects that have made policy changes and real impact in Montana's lives. A project that we still are currently working on is the Living Well in the Community workshops. These are the chronic disease prevention and health promotion workshops, 10 weeks long, that were developed by, with, and for people with disabilities. We have facilitators across Montana. We work directly with the Centers for Independent Living to implement these. If you work with people or are interested in learning more, please reach out. This quote says the 10-week program allows individuals with disabilities to create a healthy lifestyle plan unique to their desires. That is something that is so powerful. It's unique to their desires and strengths to overcome everyday and ongoing challenges and to reach meaningful life goals. Living Well is awesome. From Darren Larson, one of our facilitators, and this is a picture of a group of our facilitators getting together. And this is another independent living specialist at Ability Montana, Charles Alvarez. He is not only has been a participant of Living Well, but also has a huge story and is now a facilitator of the program. Some additional resources and training. We've been promoting the responsive practice training. There's 2 modules, one that focuses on specific care in a healthcare setting, like a primary care appointment, and then accessible and adaptive communication. I think both remain relevant to public health professionals, even just learning what that communication looks like. It's free. It has actors with disability in it, about 1.5 hours with CEUs available. And Erin and I will send out follow-up materials with these modules and links. Screening for All is another resource that has accessible resources for both patients and healthcare professionals for accessing preventative health care. So really thinking about the public side of healthcare. How are we encouraging people with disabilities to work with their provider and decrease those barriers that we've discussed throughout this whole presentation. We'll also provide you with a list of additional resources and with our evaluation link, because we want to know what you thought of this presentation. So in the remaining time, if anyone has any questions, I'll also transfer it over to Tony if he has any words to share.
Yeah, thank you for that great presentation. And yeah, we have a couple minutes for questions. So if you have a question, just pop it in the chat or go ahead and come off the mute and ask a question there.
I'd like to hop in with a quick question. Thank you all so much for the great presentation. I was hoping that you could just briefly share a little bit of information with us about the most inclusive and respectful approach in terms of, inviting folks in. Kind of what I'm getting at is I'm hearing a lot of working with people with disabilities, and that kind of language has come through in your presentation, as opposed to, what used to be termed disabled. And so I'm curious a little bit of, from your perspective, like what is the most welcoming, respectful, kind, empathetic community perspective with which how to refer to individuals living with disabilities?
Just clarify, is this a language question or is this a invite people in to participate question?
Yeah, I guess a little bit of both, Mackenzie. Primarily language, just because even in that first initial outreach, just thinking about, how to make that initial outreach, I think the language is important at the beginning.
I saw Shyla come off mute. I wanna hear what she has to say first.
I think the best thing to do is to just use a person with a disability, but get to know the individual person that you're working with by name. For organizations, just bringing them together, and they're all going to have an idea of what their individual mission is. I can't really say, because some agencies use person first language, others use like self-defining language. So it kind of depends on what model you look at and how you work with everything. Um, so that is my thought on it. And I have somebody at my door, so I'm going to say thank you for having me today. And if you have any questions, please use my contact information on
Thank
this
you, Shyla.
on this stuff. So thanks.
Thanks very much, Shyla.
And this is Mackenzie. As far as language, like I default people first language, and then you just start asking people. You'd get to know them, and also, as Shyla said, know their name. That's actually how people want to be referred to and talked to and invited in. If you're talking about local communities, first reach out to the Center for Independent Living. See what connections they have with your community, and then if you're just doing a call out, make sure let us know what support needs you have. What accessibility supports do you need to participate fully in this activity or this planning session? Be open, because what I have found is there's fatigue and asking for those supports over and over and not really knowing if someone's going to follow through. So being willing to provide those, and then if you don't know how to get that, go to the Center for Independent Living. You can reach out to us and we can provide some additional supports on how to get those accommodations in place, because that's how you get people with disabilities to work with you, is that you're providing those accommodations. Meg, would you add anything else?
Yeah, I think one of our goals was to share that, in the same way you might partner with aging services, Centers for Independent Living are like that. University Centers for Excellence are like that. There are lots of disability organizations, and I'm going to put them in the chat. Partnering with an individual with a disability is not the same as partnering with the community and the organizations that have worked hard to try and negotiate where we disagree and where we agree. And it is about, developing a scope of work that we all agree on, and using our CBPR principles, and really thinking, again, it's a very diverse community, and this is a long time. CCD is the group that really came together to pass the Americans with Disabilities Act, and there's hundreds of organizations under that umbrella. I don't know. Molly Kimmel might have some more to add, but yeah, I think it's really important for us to be working together that way. Some of us tend to work with a specific condition or diagnosis group, but it doesn't mean we aren't a part of a cross-disability group.
Well, I'd like to thank you guys for your time. So Mackenzie, Meg, Erin, and Shyla, thank you very much for the excellent seminar. And I know I learned a lot. So and thanks for sharing those resources too. Mackenzie, if you wanted to, I guess they will be in the recorded Zoom link. So, but if you wanted us to share those too, just send those resources and we can forward them out too. But with that said, I'd just like to thank you guys again, and we'll see you next time. So next week's seminar will be from the State Health Department again. So thank you guys. Take care.
Thank you very much.
Thanks,
Bye.
Tony. Bye, everybody.